Hi, very good afternoon to everyone. How are you all doing? I'm here to talk about glaucoma. Today, my aim, my focus is to our glaucoma patients. What we can do. Once you are diagnosed glaucoma, what you can do, what we as a doctor can do. When it comes glaucoma, the only modifiable risk factor in our hand is to reduce the pressure, eyeball pressure. How we can do, the only significant intraocular pressure reduction is only achievable through medications, or medication fail, we do some surgeries. There's invasive, non-invasive, or sometimes we do laser treatments. These are the modalities of treatments that it has significant pressure reduction in number of patients. So when it comes to drops, how are we going to put the drops? Please remember, it's not like taking a tablet, put everything in the mouth and drink a glass of water. When it comes to glaucoma, don't do that. Drops for glaucoma have its own SOP. First SOP that I always emphasize is we have to make the drops go in according to hours. If a doctor say that twice a day means every 12 hours the drops must go in. If the doctor said once daily, please ask the doctor, is it in the morning or at night? And fix the timing. Timing is very, very important. Then when we put the drops, when you got more than one drop, we must practice spacing. One drop, another drop must have spacing. Be practical. Some say 10 minutes, 15 minutes, but in glaucoma management, I would say that make it 5 minutes. More than 5 minutes doesn't matter, but not less than 5 minutes. Try as much as possible, there must be a spacing. From my point of view, 5 minutes is sufficient from one drop to another drop. Then the third is the technique of putting a drop, and must be clean. The tip is always sterile, so whenever you open the bottle or close the bottle back, must make sure the tip is not touched with anything. When you put the drops, the eyelashes also shouldn't touch the tip. We have to make as sterile as possible, because when it touch anything, any surface, it can cause a cross contaminations. After put the drops, there's a few things that I used to ask my patient to follow. The punctal occlusion is very important, because the moment you put the drops, you blink, all the drops will go to the nasal lacrimal duct to your throat. So the contact time to the eye will be less. So we have to maximize the contact time. How? We have to manually block the nasal lacrimal, the canaliculi punctum, so that the drops has enough time in contact with the ocular surface, so that more drops can diffuse into the ocular structure and give a maximal effect. So how to do? You just have to take your fingers, press at the corner of the eye, not the bone, at the corner of the eyeball, and start count, slow count, 1, 2, 3 until 20, and let go. By doing this, you will have enough contact time. With the enough contact time, with the minimal drops, you can get a maximum drug effect. Now is March 2022. Every March is our glaucoma awareness week, where we do a lot of campaign awareness program in TV, in radio, now we do in Facebook, Instagram. A lot of activities are going on. We from Optimax also we take part in this program. For this year, for the month of March, we do a free eye screening for those who feel they got risk factors. They want to check whether they got glaucoma or not. But we have to make an appointment, because looking at this current pandemic, and now we are moving towards endemic. Give us a call, book an appointment, check your eye, make sure you are not glaucoma. Thank you.